Parents in Washington state will no longer be able to refuse to vaccinate their kids against the measles based on personal or philosophical objections. That's under a new measure signed into law just this past Friday. The change follows a measles outbreak in Washington and several other states across the country, totaling more than 800 cases nationwide, the highest in 20 years since the vaccine effectively eradicated the disease in the U.S. Officials are attributing the spike to high populations of people who refuse to take the vaccine or stop their kids from taking it. Some, like the World Health Organization, call it vaccine hesitancy. Talk about euphemisms. The WHO, by the way, has named it a global threat to watch. It's an issue that many doctors have been speaking out against, and now some of those doctors have experienced widespread cyber harassment on physician rating websites organized by anti-vaxxers. One of the people who's been targeted is MGH physician Monique Tello. She joins me now. Doctor, it's good to see you. So all this begins, if I'm right, I read your story in the Globe, when you post in support of a fellow doctor, a pediatrician in New York City. That was how it all started, right?
Yeah, it was August. Jen Trachtenberg's a pediatrician in New York.
Manhattan, yeah.
Exactly. And she had put a very informational little video for Vaccine Awareness Month on her Instagram feed and was immediately slammed with over 100 nasty comments.
So you decided you just wanted to show her support, and here's what your post is. It's not exactly threatening. If more Americans spend time in the developing world, where you have, by the way, where people without access to basic medical care are far more likely to suffer and die from preventable diseases, we would not see any opposition to vaccines. I feel sorry for people who believe the unsubstantiated claims of this bizarre, illogical anti-vaccine movement. What happened after that?
Yeah, so soon after that, the next day, actually, negative comments started coming in on multiple physician review websites like Vitals, Health Grades, Google.
Saying what kind of things about you?
1 star, you know, across the board.
The lowest rating.
The lowest possible rating, and things like pushes her own agenda on patients, doesn't listen, danger, you know, harmful, things like this.
And they weren't even your patients in virtually all these cases, were they, or were they?
So they're anonymous. What we do is we ask the websites to look at those comments and see, can you tell where these are coming from? Because if they're coming from like Oregon or Arkansas, I don't practice there. So that's not my patient.
And were they?
Apparently they were from other places. They met all the criteria for being fake negative reviews.
How does this affect you as a human? Not as a, I mean, as a human being trashed for essentially a statement of the truth, not exactly some radical political statement.
Oh, yeah. Well, the thing is I didn't even realize this was happening for a few months. It wasn't until I was at a medical conference and one of the speakers encouraged us all to Google ourselves. And I thought, why not? I'll just Google myself, see what's out there. And I was horrified to see there was almost 100 of these really nasty comments on me. And it was devastating, you know. I mean, you go into primary care for the love of medicine, for the love of taking care of people. It's certainly not a high-paying specialty.
And by the way, just so if I remember correctly from the Globe story, it's not just the psychological pain you suffer. You told a story of a patient not coming to you. I mean, just one you'd heard of. Tell that story if you would. Yeah,
sure. A colleague came to me. You know, she was a little bit shy about it. She said, Monique, I have to tell you, a patient of mine has a family member who needs a doctor, and I recommended you. And they said, oh no, we read about that doctor. We saw the reviews. And
so if there's one, you have no idea how many others who didn't come to you as a result of what they read online.
Or who don't want to read what I write,
You know, when I first read about you, I was saying, I asked myself a question, well, is she going to stop doing this? And then I said, well, obviously she's not, or she wouldn't have done a story with the Globe.
Oh, yeah, no.
Hey, was there any piece of you that said, as horrible as this may be, I got to stop speaking because I can't deal with this kind of criticism? Was there any of that?
Of course. I mean, I think I was lucky because I was not threatened. A lot of doctors who post about vaccines or put information out there, writing out there, get threats against themselves, against their families.
Some of them, I've read, have said, I will stop. I won't be talking about vaccines anymore because of the personal threats I've experienced.
Yeah, it's real. I mean, it's real. So some people do step back, and I understand that. This experience has fired me up. I'm definitely much more involved and vocal about not just vaccines, but a lot of different public health themes.
What should a doctor do or a medical professional do who's in the same position you are, telling the facts about vaccines, trying to ensure there's public health, if they are the target of any of this kind of thing? What do you recommend they do?
Well, since this has all started, this has only been like the past 2 years that we've been seeing these types of attacks, sort of a new thing. There are now, as of the last couple of months, some organizations that are helping doctors to support doctors who are being attacked.
You're leading one of them, are you not?
Co-moderator.
Okay, what's that called? Whatever that means. What is it called?
Physicians standing against harassment and intimidation, and cyberbullying and harassment.
And they can contact that organization and they'll get some help. Yes?
Yeah, any physician can join. It's physicians only.
What happens when a patient comes to you who, in total good faith, because of the crap they've heard or whatever, and says, I have a good doctor, I have a good faith objection. I don't want to be vaccinated. I want to vaccinate my kid. I've done my research. What do you say to that man or woman?
I understand their hesitancy because the movement, the anti-vaccine movement, is very prevalent, and they're putting a lot of scary stuff out there that's just not true. So I get it, and I'm not going to fault the person who's hesitating. Rather, we try to form a relationship and educate them.
Does it usually work?
It has. I think what really works is an outbreak. like the measles, for example, outbreak. People all of a sudden are like, oh my gosh, this is real. I can get sick. My kids can get sick. This is really a serious thing. And that tends to change minds.
Well, how about
pretty
also
fast.
the fabulous kid who testified in front of Congress, who essentially decided to make himself independent and get himself vaccinated against his parents' wishes. So I'm assuming you support notions that all states do what Washington State, and I think Maine has done, no exemptions except medical ones. Is that the direction in which we should be going?
That would be the safest route if we want to try to stop outbreaks. Yeah, I think that would be the way to go.
And did you read the piece in Politico by the Kennedy siblings and uncle of Robert Kennedy Jr.?
We were very happy to see that.
Where they basically said, we love Bobby Jr. He's been on the show, by the way, talking about environmental things, but he's an anti-vaxxer, an anti-vax leader, I should say. That kind of calling out, or for example, when the President of the United States flipped his position and recently said, you got to go get those vaccines, those high-profile things do trickle down in a positive way, do they not?
Very powerful. Yeah, that's very powerful.
You have 30 seconds left. What do you say to people at home who are on the fence and are not anti-vaxxers but concerned? They're skeptics, they're doubters. What do you say?
Yeah, I encourage them to have a conversation with their doctor or some other medical professional or even a scientist who they trust. I mean, there's a lot of good evidence out there showing that vaccines are largely safe and do protect people. There's not a lot of high-quality evidence stating otherwise. So I think if they can just have a conversation with somebody they trust who understands the evidence, who can explain it to them, I think that'll make all the difference in the world.
Keep doing it, Doctor. It's a pleasure to meet you. Thank you so much for your time. Really appreciate it.